We've had Tyler for about 9 years. We picked him up from our rescue home and we think he's probably about 12 years old. Tyler has always been an active dog, but recently he started slowing down and sleeping longer, looking stiff and sore when he gets out of bed. It seems like it takes him about a day to recover from any long walks. He's been putting on weight and it doesn't help that I always give him some tidbits in the kitchen. I'm worried that it could be something quite serious and not just old age, which is why I'm going to take him to the vet for a quick checkup.
Hi there, how are you doing? Right, let's pop Tyler up on the table. You managed him there okay. So what can we do for Tyler today?
Just a wee bit worried about him, to be honest. The last few weeks we've noticed he's been getting a bit slower and taking a while to recover from his longer walks and just a bit stiff and sore when he's getting up in the morning off his bed.
Okay, and how does he seem when he's actually out in the walk?
He's okay, he's a bit slower than usual. He usually runs about, but yeah, a bit slower.
And you don't notice any specific lameness on any particular leg? Do you think it's...
I think maybe his back legs.
Right, okay, excellent. Let's have a wee look at him then. So, he's normally quite fit and well?
Yeah.
And you haven't noticed any other problems with him recently?
Nope.
No, so no ongoing issues, okay. So I think if you're worried about the back end, what we'll do is we'll just have a wee feel down his back end here, okay? Just feeling for any stiffness in his joints, especially in his back end, because that is something that can cause a wee bit of trouble for older dogs. So we'll just have a wee feel of his joints. All right, wee man, you're okay, it's okay. Good lad, I know, you're a good boy. Well done, eh? It's not nice. Good lad, and just have a wee feel of this leg as well. Good boy. He does react when I'm manipulating his hips there, and it does feel that he has got a wee bit of stiffness in those joints, which is not uncommon for dogs that are just a wee bit older. And certainly the signs that you describe, trouble after exercise, this generalised stiffness, this sort of longer period of time to recover from exercise is a really common finding, and it's most likely to be arthritic changes within his joints. Now that's nothing to worry about. I think it's good that you've brought him in so early. You know, there are lots of things that we can do to help these types of problems. What we tend to do is three-pronged attack. The first thing we always recommend is shorter walks more often is much more appropriate for older dogs who have these types of problems. The second thing, really important, is weight management, making sure that he's not putting on weight as he's getting older, because that will just increase the stress in his joints. And the third thing is we can give medication that really helps to reduce the inflammation and the pain within his joints, because there's certainly some discomfort there. We don't always take x-rays to diagnose osteoarthritis, but certainly we've got some pictures here that might just help illustrate what's going on. We've got a nice normal hip at the top here, and you can see how smooth the ball and socket joint is here. And then if you look below, you can see all this fuzzy reaction around the edges of the bone here are representative of degeneration, and this is classically what we would see with osteoarthritis and what's causing the problems today with Tyler. We're going to start Tyler on some medication to try and help with his problem. This is really going to help him feel a lot better about his mobility and hopefully take away some of the inflammation within his joints. We'll start that medication today. And it's really important that we see you again in about 7 to 10 days' time just to check in on how things are going and review what we're going to do with the medication in the longer term.
Since taking Tyler to the vet, we now know he has mild arthritis and there's nothing to be scared of. There are lots of things that can be done to manage his condition which make Tyler more comfortable. The vet gave us some tablets, which Tyler doesn't mind taking at all, and they've really helped and he's moving around a lot easier. I will be taking him on short regular walks rather than one long one where he would struggle to keep up. I'm really glad we went to the vets when we did, because we now know how to manage Tyler's arthritis and he's happier as a result.